Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. I'm excited to bring you these programs that are going to provide information about health issues relevant to our community and to your health. We're going to be having physicians and healthcare specialists on the program that will help identify those issues and tell you where to go to get help if you need it. In addition, we're pleased to introduce Medical Edge. They're medical announcements provided by Mayo Clinic, a partner of Kingman Regional Medical Center. My guest today on the show is Liz Barrere from our Dizziness and Balance Center here at Kingman Regional Medical Center. So stick around and don't miss the show. We'll be right back. Welcome back to Your Health Matters. My guest today is Liz Barrere from our Dizziness and Balance Center here at Kingman Regional Medical Center. We're going to be talking about vertigo and the Balance Center. Welcome, Liz.
Hi. Thanks for having me.
It's great to have you on the show. Liz, you're a physical therapist with the Dizziness and Balance Center.
Correct.
Tell me a little bit about what that means.
Well, I specialize in vestibular rehab. I've received special certification where I've gone on to take additional coursework and take multiple tests to have more knowledge on working with people that experience dizziness. I've been a physical therapist for 15 years.
Wow. And how many of those years here at Kingman?
I've been here for a little over 4 years.
Okay, so you've been here for a while. That's great.
Yep.
We appreciate having you on the team.
Thank you.
And I know the Dizziness and Balance Center, have they been open a year yet? It's pretty new.
Yep, it's been almost a year.
Okay.
Yep.
Very good.
And we're doing very well.
So the people with all kinds of issues you're going to see.
Yes.
And I think we're going to watch a clip here that's provided by Mayo Clinic, their Medical Edge, that's entitled Vertigo. So let's watch that for a second and then we'll talk about it afterwards.
Vertigo is the sensation of spinning, falling, tumbling, and turning. Victims can feel nauseated, off balance, like they're losing control. Bouts of vertigo can be very scary, but doctors at Mayo Clinic say for people with a particular type of vertigo, treatment is easy and very effective.
Go down here like that.
There's nothing high-tech about treating what's called benign paroxysmal positional vertigo, but this series of head positions made all the difference for vertigo sufferer Mark Woyan.
And I noticed them first actually here at the gym, doing like lifting heavy weights. Whenever I would tilt my head to the slightest degree, it would feel like the world was spinning around me. Lightheaded, nauseous, dizzy.
And it's a mechanical disorder that develops because some of the normal little calcium particles that our inner ear creates in order to help us sense gravity and movement float into the wrong part of the system.
Dr. Scott Eggers says in addition to feeling like the world is spinning, people with vertigo also experience rapid eye jerking, which happens when your inner ear balance system is stimulated in the wrong way.
I'm watching the patient's eyes and looking for any nystagmus to develop.
This series of head positions can stop symptoms because it helps the dislodged crystals float back to where they belong. Here's what's happening inside the ear. You can see how the crystals have migrated to one of 3 semicircles in the inner ear. By moving the head in a specific pattern, those crystals float back to their original and correct location.
So as soon as Dr. Eggers put me through that maneuver, 20 minutes after, I was feeling 100%.
Back to lifting weights without worrying about debilitating dizziness. Dr. Eggers says people like Mark who get this type of vertigo may have another bout sometime in the future. If so, the same series of head positions can help relieve the symptoms again. Now, there are other conditions that can cause vertigo, so it's very important to see your healthcare provider if you develop symptoms. For Medical Edge, I'm Vivian Williams.
Interesting. It gives a whole new meaning to rocks in your head.
Yeah.
I always thought that was just a
saying,
but
nope.
You really do have little rocks in your head. How funny.
You do. That particular issue is called benign paroxysmal positional vertigo.
Easy for you to say.
Right. Well, what happens is we have these autoconia, and they're carbonate crystals that belong in a particular area of our inner ear. But for whatever reason, they become dislodged, and then they go into one of 3 different canals on in the inner ear. And so what can happen is any type of particular head movement or positional change can bring on an abrupt onset of dizziness. It's actually a very easy issue to resolve. We just do a few head maneuvers,
Okay.
and they usually feel better within hours or within a 24-hour period.
Great. Wow, that's
Yeah.
good. But now, what other kinds of issues there's other things that cause vertigo and balance issues? right?
There's a lot of things. Just like in any other part of our body, we can develop infections in our inner ear, which can result in a diagnosis called a labyrinthitis or a vestibular neuritis. Well, that can bring on episodes of dizziness and disequilibrium, unsteadiness, nausea. Those issues can also be treated. We do it through exercises, through education, so that they can help learn to resolve their symptoms and get better and be back on their feet.
Okay, so what kind of things do they do at the Dizziness Center? I mean, you said exercises, and I know we have almost like a little gym in there, right?
We do. Well, people need to go through testing, and that's
Okay.
when they're brought in to see our audiologist, Dr. Katie Brown. And once the testing is done, then they usually will see me shortly afterwards. And I give them exercises to address whatever issues are making them dizzy.
Okay.
Sometimes it's something as simply as turning their head side to side, focusing on a particular object. Our inner ear functions in controlling eye movement along with head movement. And our eyes need to be able to be stabilized when our head is moving. And if it can't do that, when the inner ear is unable to maintain that function, that will usually bring on the symptoms of dizziness. So that's usually one of the exercises. And other things can be just learning how to maintain their balance, getting up from a chair safer. The inner ear can be strengthened just like any other part of our body. It
didn't
just
realize that.
takes particular exercises.
So it's not a matter of wiggling your ears.
Right, exactly.
I think there's a kid I knew in junior high that used to wiggle his ears. He probably had really strong ears.
You probably did, yeah.
So can a person just call over at the Wellness Center to make an appointment, or do they need a referral from a doctor?
They need a referral.
Okay.
Yes, they need to go to their primary care physician and consult with them, because there can be other things that can cause dizziness too. So it's really important, if they are experiencing it, to make sure that they are addressing all the other issues, such as heart-related issues.
Okay, I was just
that
going to
could
ask what
cause-
other kind of things, the heart,
Yep.
like-
Brain-related issues,
Okay.
blood pressure, all those things. So it's important to always consult with their primary care physician first.
and then they'll make the referral and get them into the
Yep.
Dizziness Center.
And then we'll
Okay.
get them taken care of.
So when like a person say has had a stroke, I know that there are a lot of times that they'll have balance issues. Do you work
Right.
with people in those situations also?
I do.
Okay.
I do, yep.
And what kind of things do you do for them?
In those situations, well, sometimes people can have dizziness following a stroke too, and then of course I'll help to address those. But it may be strengthening the weakened side following the stroke, improving their perceptual awareness of where their body is in space, showing them how to regain the ability to getting up from a chair, getting up from a bed, and working on the coordination skills that they lose.
Good, good, good. So the Dizziness and Balance Center is here on the campus, in the Delhi Webb Wellness Center. So do they actually come in through the Wellness Center? How do they find you? I know you're not right visible.
Well, they come right in through the Wellness Center, and we do have signs on the front door that has our name and our logo up. And they walk back right to our rehabilitation department.
Okay.
And if there's ever any confusion, they can always stop and ask one of the wellness members, and they'll help to direct them. But we are located in the Wellness Center.
Okay, well, it fits well. You partner well with that whole
We do.
group. And I know I always share with people that when I first came to Kingman, and one of the things that first drew me to Kingman Regional Medical Center was the fact that we're not just focused on the sick and the dying, if you would, like a lot of
Right.
hospitals. We actually focus on health and well-being and
Right.
the whole person. And so, of course, our wellness center here is just an amazing gift that we have for our community. We've talked about those things before too. And this whole building. We've got outpatient physical therapies here, our cardiac rehabs here, now the Dizziness and Balance Center.
Right.
So those are great programs that we have to offer here. Do you use any of the equipment in the Wellness Center for your therapy groups, or is it all pretty much inside the...
Nope. As a matter of fact, what we do is we really try and transition our patients into being independent and carrying through with their exercise program.
Okay.
Part of our rehabilitation process at the end is to offer them a month free membership to
that's
use
a nice little Benny.
It is really nice. People really like that.
I bet.
Because then they're encouraged to maintain that same level of mobility, and we really stress the importance of exercise. It's the first thing you can do to kind of empower yourself to continue on the healthy path.
Very good, and that's an ongoing thing. It's a life change, really.
It is, and we show them what type of equipment we would like for them to continue with, and then also to show them how to use the equipment too.
Very good, very good. Well, I was wondering about that, if you tied into that, and
Yep,
so it's good
we
to
do.
know. You know, we had Katie Dr. Brown on our program a couple of weeks ago, and she shared with us some of the issues of hearing loss and the things that she does to identify it. So this is a good transition to the next part of that then, after you see Dr. Brown and then they come and see you.
Yes.
That's very good. Now, are there other folks as part of your team? Do you work with are there other physical therapists or staff members who are...
We do. We have a very large physical therapy and occupational therapy as well as speech therapy department, and I do work right alongside with my other co-workers.
Okay.
And in many cases, I'm working with other disciplines to help people, especially occupational therapy and speech therapy, with issues such as after they've had a stroke or Parkinson's disease or other neurological disorders.
Right, I was thinking about that there are a lot of other things that can cause the dizziness.
And balance problems.
Right. And are there any other things like that you can think of that people
Well,
might...
It could be also multiple sclerosis can be another issue. But there are, and in some cases it's an idiopathic type of issue where there's dizziness or motion sensitivity, but yet there's really no clear-cut diagnosis. In many cases, those individuals are more just a motion sickness type of disorder. I can help with those issues as well.
Good. Well, let's hold that thought for just a second.
Great.
We've got a couple of other messages we're going to show, and then we'll come back and talk about motion sickness. Very
Sounds good.
Stick around. We'll be back shortly.